I'm so excited to introduce today's keynote speaker, Dr. Unruh Cohen. We're so fortunate to have such an expert and veteran in climate policy here today. And Anna and I first crossed paths about 6 or 7 years ago on Capitol Hill. And in learning about and following her career, it's just so clear to see that she has been one of the most prominent driving forces for climate advocacy and action in Congress, which has really changed it more rapidly in recent years, as you likely know, and as Anna will likely speak to. And when the House Climate Crisis Committee was established in 2019, we were overjoyed to hear that Anna would be at the helm. And Anna, we're grateful to have you here today to help us understand the landscape and perhaps where health professionals can help drive the action that we really need. A bit more about Anna's background before I hand it over. Dr. Unruh Cohen is staff director for the U.S. House of Representatives Select Committee on the Climate Crisis. Previously, she was managing director of government affairs for the Natural Resources Defense Council, or NRDC, and the NRDC Action Fund. During nearly 2 decades of policy experience, including 16 years on Capitol Hill, she served as the director of energy, climate, and natural resources for Senator Edward Markey, and deputy staff director of the Natural Resource Committee Democratic Staff, deputy staff director and chief scientist of the Select Committee on Energy Independence and Global Warming, and as a legislative assistant in then Representative Markey's personal office. In addition to her time in Congress, Dr. Unruh Cohen was also the first director of environmental policy at the Center for American Progress. Dr. Unruh Cohen earned her undergraduate degree in chemistry from Trinity University in San Antonio, Texas, and her doctorate in earth sciences from the University of Oxford, where she was a Rhodes Scholar. So thank you, Anna. We're so excited to have you here today, and I will pass it over to you.
Well, thank you very much for that kind introduction, Colin. I'm glad to see you are still helping to advance climate progress. And I also want to thank Mona for the invitation to join you all today. And just, what a great idea it is to have this medical society consortium on climate and health. As you've heard, I've been working on climate here in Washington, D.C. For many years now, and had the great opportunity to come sort of straight out of graduate school, interested in the policy implications of the research I had been doing in climate science, and really just found a great avenue for my career and professional opportunity here in Washington, D.C. And I've been incredibly lucky to work with Mr. Markey, now Senator Markey, for all those years, and now to have the opportunity to work with Representative Kathy Castor, who's the chair of the Select Committee. She represents the Tampa Bay area down in Florida, and just really 2 wonderful legislators dedicated to climate action and understanding just the real power of the health community and reaching the public on the climate issue via talking about their own health, their kids' health, their community's health. So I want to really impress upon you, and probably everybody who has decided to, every health professional who's on here today who's decided to give up their Sunday afternoon at the end of a incredibly challenging year plus for the health community to focus on climate change. I know the importance of the health perspective on climate change, and I just really want to thank you for everything you've been doing and will continue to do. As Mona said, this is a really important year or 2 coming up, and we really need to take the opportunities that we have. And that, advocacy from the health community has really been building, and I feel lucky to have been a part of it. I worked for a previous select committee focused on climate change that Representative Markey chaired back in 2007 to 2011. And one of the things we did in 2008 was actually have the very first solely health climate change focused hearing in that select committee. And it just really underscored the importance of the implications for health from the climate crisis, and also just the opportunities that we have to twin climate action with things that also help people's health improve: clean air, clean water, getting people moving. All of those things help address the climate issue and also public health. And then we were really, as we moved into 2009, an opportunity to pass comprehensive climate legislation through the House in the Waxman-Markey bill. We had then Representative Capps from the Santa Barbara area, who put into Waxman-Markey the first pieces of legislation to deal directly with climate and health. And you know, obviously we were able to get that bill through the House, but not through the Senate. But that language and that health-related piece of legislation lived on for many years until recently in 2017, Senator Markey sort of decided we needed to update that piece and make it represent the current state of affairs. And just last week, I think, Senator Markey and Representative Cartwright reintroduced the Climate Change Health Protection and Promotion Act. And I know a number of the societies who are sponsors of this conference, and probably a number of the participants on the call today have helped inform that piece of legislation. And I think we'll have some opportunities on that front coming up. And just to underscore one of the things, the work of the Select Committee in the last Congress, Speaker Pelosi didn't give us a lot of specifics. She just told us figure out what Congress needs to do to solve the climate crisis. And we took on that challenge holistically. It's not just about reducing pollution. It's also preparing for the impacts that are already here. And unfortunately, will likely get worse before we can get them better, which is why we're all doing what we are doing. But also incorporate those issues of environmental justice and the workforce and labor needs that are going to come with, frankly, transforming our economy. So we tried to treat that, deal with that holistically, and in the end of June last summer, despite obviously having to make some changes to how we were working because of the pandemic, we were able to put out a majority staff report that really collected all of those recommendations. It's a big book if you print it out, but luckily we have it online. So I'll just drop that in the chat if you haven't had a chance to look at it. So the first link will take you to the full report and some other shorter pieces, including, although I put the recommendation or the link in the chat directly, we had a chapter focused on health actions because there's so much that needs to be done there. And obviously, releasing it just a few months after we had to sort of radically change what the world was doing because of the COVID pandemic, that really underscored so much of the importance of both global cooperation on health issues, monitoring, having a robust and public health service, and and the health community being able to adapt. And a lot of the things that we need to do as a country and the world to prepare for the next pandemic are also things that will help us prepare for the consequences of the climate crisis in the health space. So there is a nexus there that we've really been trying at the select committee to underscore and to help as we're taking action to address issues with the pandemic. We're also trying to look at those with an eye towards how does that help us deal with climate change. And obviously the election was good news for people who want to take climate action. The Biden administration has come in with a big focus on climate change, and not just solely, but incorporating it into what they're doing on the economy, and with an understanding that we have to do it in a way that leads to justice for those communities that have really suffered the burden of environmental pollution and are more vulnerable to climate change all of these decades. So it's great to be able to have a partner in the White House and across the Capitol in the Senate. And we're looking forward to taking that opportunity to move forward. So, which brings me to the opportunities. Obviously, I heard from Senator Whitehouse yesterday, and I'm sure he gave you a great inspirational talk. That's a hard act to follow. But I wanted to, probably the one thing to start with is just for everybody to understand there is so much that we need to do on climate change. Basically almost every bill that's moving through Congress has an opportunity to include something that will help us, that will help advance climate action. And that's sort of the mindset that House Democrats have taken both in the last Congress and now. As we're moving things, whether it's the things we deal with every year, like the appropriations or the National Defense Authorization Act, how can we incorporate things in there that help our government, help people better respond to climate? So I want to encourage you. I think sometimes people ask, well, like, where's the climate bill? And unlike 2009, there's not really going to be the climate bill. But what's going to help is that we members of Congress hear that everything we're moving, we need to move. We need to write through the lens of how this can help on climate. So obviously, though, we do have a big opportunity. President Biden has put forward both his America's Jobs Plan and American Family Plan. Congress we're going to work on legislating on those fronts. One we will make a big investment in infrastructure, and President Biden has made clear and reiterated that at the end of this past week that needs to include the type of investments we need to shift our economy to ultimately to net zero emissions, to get electricity, to get carbon pollution out of electricity by 2035. So we'll be looking for every opportunity to do that. Congress will have an opportunity to make investments in programs that will help advance that. Probably looking at the tax code as a way to move that forward. We'll need to invest in transmission, and transportation options that will give people the opportunity to have choices that are carbon free or low carbon. And people are working hard to see if we can get something like a clean electricity standard in through one of the various legislative processes. And that's, part of the challenge is that while Democrats have the majority in the House and the Senate, it's not by big numbers. Back in 2009, we had a large majority of Democrats in the House and in the Senate. So the narrowness of control does make things a little more challenging to legislate. And it's not as straightforward as we were able to approach things in 2009. And I would also say, again, going back to the breadth of the issues we need to tackle when it comes to climate change, it also means there's a lot of committees that have responsibility for those things. So the great thing about the select committee is we can be cross-cutting. If it's about climate, we can do anything. But the committees that are, tasked with writing the legislation do have their own jurisdiction. So you all probably know energy and the Energy and Commerce Committee. A lot of health issues move through there. A lot of energy, Clean Air Act, climate change move through there, and they are obviously going to be critical. But in this case, also the Transportation and Infrastructure Committee is important, both for the transportation part of things, but they also have a lot of the FEMA and disaster response and economic development type of issues. So they're important. And then natural resources has tribal issues, all of those things. But also in Ways and Means is dealing with the tax issues. Financial services, you may not think of them, but they have a lot of housing policies, a lot of flood insurance. So, I'd encourage you all as you're thinking about your advocacy to think broadly. And so, everyone knows you can come to DC and talk to your members, but it's also utilize that opportunity to talk to them in district, get to know their district staff, incorporate them. And one of the key things that I think often gets lost too is the ability to partner with other influencers in your communities, like mayors, like university presidents, like the leadership of for those of you that might work for big hospital conglomerates, sorry for lack of a better word, getting those people who talk to the members of their delegation a lot to understand the climate health nexus and the importance of including health as we go forward. That just kind of doubles, triples the impact of the health community. And then obviously every chance we have to educate the public about the connection between climate change and public health is critical. So, whether that's in your day-to-day interactions with other opportunities that you might be able to have to speak more broadly or include or be, in the media, that is really, really critical. So I'm going to stop there because I think I might have been going too long. And your questions are, obviously, inevitably more interesting than what I was able to just say. So I'll stop for now.
Thank you. Thank you so much, Anna. That was extremely informative and helpful. And I especially liked your one of your recent points about, how many different committees there really are with jurisdiction and importance for discussing with them. And that's definitely something our advocates are excited to do. And I do have a few questions, and we only have a little bit of time, but we'll try to get through a couple of these. One of the first ones is Lisa from Michigan asked, as Senator Whitehouse mentioned, that we should use our healthcare voices for advocacy, but said that our representatives also pay attention to large lobbying groups who have a lot of access. And oftentimes those large lobbying groups aren't paying attention to climate solutions or, in some cases advocating against. And so what is a better way to mobilize representatives to kind of actually do the work that constituents feel they want them to do?
Well, that is true, especially in DC. And so that's one reason why I think thinking about what you can do in your local community and at the district level offices and partnering with some of those other important voices. I mean, members of Congress, when their mayors are coming to talk to them, they are paying attention. So I think, that mayoral voice in particular, or if they have a big university or other, I know in many districts now, healthcare is one of the big employers for districts. So when you can find those other VIPs to partner with, I think that can be really incredibly impactful in what happens up here. And then obviously, the work of the medical societies and their advocacy and lobbying up on Capitol Hill is also important. But I think that trying to see how you can multiply the sort of district level impact can be really impactful.
Great, thank you. And kind of a related question, a couple folks asked, what are your thoughts about activating the healthcare and public health systems, particularly through HHS, to tackle climate change, NIH, CDC, CMS reimbursement policies, etc.?
Yeah, that is really important. And also, I am a climate and energy policy person and feel a little lost when I'm going to more directly health policy. But, it's really encouraging to see that HHS is already planning to set up an Office of Climate Change and Health Equity, just to, underscore that that's going to be a priority throughout the department. Hopefully we'll see, I honestly haven't been able to pay as much attention as I would like to it, but hopefully we'll be seeing that priority setting at CDC and NIH and other places as part of the Biden administration. And I think, as you've seen, and I think I saw in the chat, this question about the whole of government approach, it really is unlike previous administrations. They're just trying to put it everywhere that you might not think, really is climate related. But as we know, the climate crisis touches every person's life in many ways. It touches the whole economy. I mean, it's just really everywhere. And, just the latest example is at the end of last week, the administration put out, an executive order on financial side of things. And a lot of that will influence, what we're doing when it comes to protecting communities from flooding and other natural disasters and helping people recover going forward, which obviously has huge health implications as well. So, there is a lot of opportunity in the executive branch, and when you can harness it in a direction to work on climate action, I think that can be really powerful. But I've never worked in the executive branch, so I will leave it to others to maybe say how you can really successfully pull those levers. But we'll be trying in Congress to give them the resources they need to do that.
Great. And then maybe one more, or feel free if there's something in the chat that you saw that you prefer. But there's kind of a question, and I think we've discussed this a little bit about, is it worthwhile to reach out to skeptics or more skeptical members of Congress? And especially the question is kind of framed around that the potential changes from the census and how seats may be changing. So, if part of the question is, do we only have a year and a half to really do anything before the next election? And you know, kind of, do you have any thoughts about the bipartisan nature of trying to move forward after that year and a half?
Yeah, I mean, I think that is actually one of the powers of coming at the approach of coming from the health community, is that even, you know, even if members are in a position that they aren't, you know, really supportive, or maybe they oppose kind of your traditional climate policy, reducing emissions, investing in renewables, that type of thing. You know, some of the other issues around health, around being prepared for natural disasters, is an entree to getting them to support at least some of the things we need to do to address the climate crisis, and may open things up. But I actually, in the House, Republicans have, you know, their leader McCarthy has realized that, you know, this climate denial just doesn't work for them, at least politically.
Right.
So they're talking about it differently. Whether we can really move the needle so that they're voting differently, I think, you know, still remains to be seen. And maybe as we wrap up, if I could just take a minute to read in our report. If you go to the preface, which again, we released this in the middle of the pandemic, in the aftermath of the George Floyd murder protests, or they were still ongoing, you know, really just knitted everything together. So we closed out the preface with this paragraph, which is maybe hopefully a good way to close out this session. The protests in response to George Floyd's death are reminders of the consequence of past inaction. While responses to the COVID-19 pandemic demonstrate that Americans can mobilize en masse to save lives, both underscore that there are no foregone conclusions. What we choose to do now shapes the future. What happens next for racial equality, for public health, for the climate crisis depends on us. So thank you for all you are doing to help solve the climate crisis. And I look forward to continuing to work with you all as we go forward.
Thank you. Thank you so much, Anna, for joining us and for that wonderful presentation. All right.